Are you ready?
Okay.
All right. So your time starts now.
Um, Hello, my name is Dr. Lily, one of the medical doctors here.
Hello.
Can I confirm that you are Mr. Tom, 29 years old?
Yes, I am.
Okay, nice to meet you. Mr. Tom, I'm going to ask you some questions, and
Hmm.
I'm going to examine you and address your concerns. Is that okay for you?
Yeah, that's fine.
Okay. So during my discussion, I'm going to take some notes, which will be confidential. Okay?
Okay.
Okay. So, Mr. Tom, what brought you to the clinic today?
Yeah, so doctor, I've been really worried about my vision lately. For the past 1 month, I've been having really difficulty appreciating anything, to be honest. Although this problem started about a year ago, but it was never really this bad.
Mhm. And is it so it is, you mean it is progressing,
Yeah,
worsening right now?
yeah, yeah.
Okay. Is it present all the time or it comes and go?
Initially, it was, just some at particular time of the day, but now it's all the time.
Okay. Um, and is it at one eye or both eyes?
Both.
Both eyes. So can you tell me exactly what do you mean with abnormality in your vision? What's abnormal with that?
Yeah, I can't see anything, for the past 1 month.
Can't see anything at all.
No, no.
Okay. And uh, okay. Did you notice anything associated with this impaired vision?
Like what?
Like for example, sickness or feeling sick,
No,
any headache,
no,
any weakness in other parts of your body,
no,
any abnormal sensation.
no,
Okay. Did you lose your consciousness before?
no,
Okay. Any hearing problem,
no,
any disorder with your balance.
no,
Okay. Any shaking in your hands, for example.
no.
Okay. So you mentioned that happened before.
Mm.
Can I ask you how often did this happen?
So it has been continuous for the past 1 year, but it got worse in the past 1 month. Initially it was just maybe in the evenings or night, but now it's, all around the day. It didn't get any better
Around
the,
today.
the 1 month. Yeah.
Okay. So can I ask you some general questions, please?
Yeah.
Okay. Do you have any chest pain,
No,
any awareness of your heartbeat?
no.
Can you sleep flat, normal?
Yeah.
Any shortness of breath?
No,
Any swelling in your legs?
no,
Any cough,
no,
coughing up blood?
no,
Any noises in your chest?
no,
Okay. Do you have any pain in your tummies?
no,
Okay. Is there any change in your appetite?
no,
Any disorder with swallowing?
no,
Heartburn or water brush?
no,
Change in bowel habits?
no,
Okay. Is there any change in your water works at all?
no,
Okay. Any pain in your joints?
no,
Any stiffness at all?
no,
Okay. Is there any skin rash?
no.
Okay. Do you experience any headache? I'm sorry.
No, like I said, no.
Okay. So, uh, is there any family member that have a similar condition,
No,
like any problem with his vision?
not that I know of, no.
No, nobody in your family.
No, I'm not aware, at least.
Okay. So, do you take any regular medications, Mr. Tom?
Just some multivitamins.
multivitamins.
Mm-hmm.
And you do you have any allergy to any medication?
No,
Okay. And do you have any medical condition that I should be aware of?
no,
Okay. And have you been admitted to hospital before?
no,
Did any surgery or any procedures?
no.
Okay. And okay, what do you smoke, Mr. Tom?
Just occasionally.
Okay. And how many cigarettes per day?
Not daily, or just occasionally, just one or two sticks.
Okay. And do you drink alcohol?
No.
Okay. And what do you work for a living, Mr. Tom?
So I used to work as a cashier, but I had to be let off my work because of this vision problem. So currently I'm unemployed.
Oh, I'm so sorry for that. Well, I'll do my best to help you with your vision problem, and I'll also involve the social team in the hospital who would also support you. Okay?
Thank you, doctor.
Okay. And you live alone
No, I'm currently with my friend.
with your friend. Okay.
Mhm.
And okay. So, Mr. Tom, can I examine you?
Yeah, sure. What would you like to see?
Okay. I'd like to first I'd like to check his visual acuity.
Okay.
I would do hand motion, hand
Mhm.
movement.
He's unable to see.
Unable to see that. Okay, so I'm unable also to do further testing. I'm going to do the neurological examination.
Okay.
Um, I'm going to start with okay, I'm sorry. I'm going first to check his hearing. Is there any
Okay.
problem with his hearing?
No, no problem with his hearing.
Okay. Neurological examination. I'm going to do pronator drift,
Okay. Normal. No drift.
normal.
Hmm.
Okay. I'm going to hear his chest.
The examiner says skip this part.
Okay. And okay. So, Mr. Tom, what is your concern?
The examiner says, do you want to examine anything else?
Yeah, I'd like to check his vitals.
Okay, they're normal, same as outside.
Um, okay. Mm,
You've got 7 minutes left, so you can examine anything else if you'd like.
um,
There are some instruments
um,
available at the bedside. Would you like to
yeah,
use any?
fundus
Okay.
actually, but
All right.
okay.
All right. I'll show you
I'd
the
like
fundus.
okay. I'd like to do his fundus examination.
Okay, I'll show you the fundus. Wait a second, please.
Okay. Okay. So, Mr. Tom, what's your concern?
Yeah, I want to know what is it, I'm really afraid. Could it be a brain tumor? Is it curable? I have a lot of questions.
Okay. So your concerns are totally valid, Mr. Tom.
Mm-hmm.
Um, well, I suppose that you have a condition that is called retinitis pigmentosa.
Okay.
Are you aware of it?
No, never heard of it.
Okay. Okay. So it's reassuring to know that it is not a cancer.
Mm-hmm.
Retinitis pigmentosa actually is a condition where the a part of your eye that is responsible for vision, which is called the retina, is damaged, and it is there are some black streaks in the part that is responsible for vision. Okay.
Mm-hmm.
Um, um, Actually, I'm sorry to tell you that it is not curable. Um, it is a long-term condition, and it is actually progressive, as you said, that it started a year ago, and it is progressively worsening over time.
So
Um,
it cannot be cured?
uh, it is the thing that I can do is to reduce its progression.
Mm-hmm.
Okay, by
How?
giving you some vitamins.
Mm.
It's called vitamin A. Which would help to reduce the progression. Okay.
Okay.
Okay, so what I'm going to do next is to order some routine investigations just to make sure that everything is going okay with you.
Okay.
I'm going to refer you to the ophthalmology, to the eye doctor. I'm
Mm-hmm.
sorry, to the
Mm-hmm.
eye doctor who will examine you carefully. And I may also refer you to genetic counseling if you would like to do that.
Yes, doctor.
Because okay, the condition is actually a genetic condition, and it may be passing to other to your sibling. Okay,
Okay. So
and
can I pass it to my children too if I decide to have any?
yeah, I'm afraid that that would be possible.
So what are the
And
chances?
okay, there are 50% chance to pass it to your sibling,
Okay. With my sibling or my children?
your children. Sorry, your
All right.
children.
Okay. So so you mentioned, vitamins could help. What about any surgery? Can I get an eye transplant?
Well, up to the point, I'm not aware actually of such an operation.
Mm-hmm.
Um, but I will refer you to the eye doctor who is a specialized doctor for that, and we will discuss together the available options to help you to go through that.
Okay.
Okay?
Okay.
Well, uh, I need you to understand that you are not alone with that, and we are all here to help you to go through that.
Thank you.
I also involve the social doctor and the occupational health team to see what's options are available to help you.
Okay.
Okay.
All right. Okay.
So do you have any other concern?
Uh, no, not really. No. Thank you. I think that's reassuring. You've got 2 minutes
Okay.
left.
Um, mm, I don't know what to do at that time, actually.
It's okay. You can just, think about if there's anything left you'd like to examine or ask.
I'm sorry.
If you like to, just go through if you've missed any examination or any part in history taking, you're allowed to ask that. But if you're ready, we can, move on to the examiner questions.
Um, okay, let's move to the examiner
Okay.
questions.
All right. So I'm going to start the timer for 5 minutes. Okay. So please present your positive findings in the history and examination.
Okay. So I have examined Mr. Tom, who is 29 years old.
Mm.
He is presented with loss of vision, which was started with reduced vision overnight 1 year ago and progressively worsened. And now he can see well. Um, I couldn't appreciate any positive data in the history actually. But during my examination, he had he can't see hand motion,
Mm-hmm.
and also the patient during fundus examination, I could appreciate some black streaks in the periphery of the fundus, which led me to thinking of that he had retinitis pigmentosa.
Okay. All right. So what are your differentials then?
Um, well, I think retinitis is my first diagnosis. I would go for search for some syndromes like Usher-Mann syndrome and Refsum syndrome.
Mm-hmm.
Um, um, I think that's all.
All right. So how would you investigate?
Well, I do some routine investigations just to make sure that everything is okay. And
Mm-hmm.
then a fundus examination is the most important step in the investigation.
Mm-hmm.
Um, um, Nothing else.
All right. So how would you manage him?
Well, I'd like to give him some uh, um, okay, regarding management, I start with patient education, non-medical treatment,
Mm-hmm.
patient education. I would give him some leaflets or some websites. I'd like to educate the patient in a way because he can see that
Mm-hmm.
about his condition. And I'd like also to refer him to the genetic counseling team.
Mm-hmm.
Um, I would want to refer him to the ophthalmologist.
Okay.
Um, okay. And then I would give him some vitamin supplementation like vitamin A.
Okay. All right. So, you mentioned some syndromes like Usher and Refsum, and you were asking about, his walking, his gait, and his balance. What were you particularly trying to rule out by asking about balance?
Um,
Mm-hmm.
by asking about balance, I was um, excluding some cerebellar manifestations or neuropathy or
Mm-hmm.
peripheral neuropathy, which may be associated with the Refsum syndrome.
Okay, good. And did you examine this in the patient?
No.
All right. Should you have examined this in the patient?
Um, the patient is not seeing well, so I think he may be using some walking aids
All right. So
because he can't see.
mm-hmm. Did you ask the patient about his walking aids, or did you see any walking aids?
No.
Okay. So you mentioned involving the occupational therapist in the management. How do you think they could help?
Because he was working as a cashier.
Mm-hmm.
Um, um, I think the patient can see they may secure some jobs for them.
Mm-hmm. All right. So there's an occupational health worker and a social worker and an occupational therapist. What would be the role of an occupational therapist here?
The occupational therapist may help him with some walking aids.
All right. Perfect. Okay. So your time is up. All right. So how do you think you did the case? How did it go?
Well, um, I think the examination was very effective.
Mm-hmm.
Um, and I don't know, but I think I'm a bit hesitating in the history, and I have skipped I've skipped something. I'm not sure about that actually,
All
but
right.
I'm a bit hesitating. I know that.
Yeah, but you didn't need to be because you did really, really well, really well. So let's start from the beginning. Let's start with when you had 2 minutes to prepare. Was there anything particular you did? Did you write down any notes or did you have anything in mind?
Yeah, I have wrote the general scheme of history taking.
Mm-hmm. Okay.
And yeah, I wrote the name of the patient and his age because I know I'm going to forget that.
Mm-hmm.
Um, Also wrote remember to address his concern.
Perfect. Okay, so what I'd like you to do this next time is whenever there's a complaint of vision, or maybe any neurological complaint, just write down driving, in capital letters so you don't forget it. In this case, he was, unable to see anything, so he wasn't driving himself. But this is something that you need to ask and address because he needs to inform the DVLA. Okay. So never forget about driving in a case where vision is affected. So when you're making notes outside, just write down driving in all capital letters so you don't forget it. So if you're done with the history, before the time ends, you can just take a look at your notes again and you'll remember about driving. Okay. So,
Hmm.
driving, job, and their impact. So, in this case, you did ask about impact, so that's fine. Okay, so outside you did well. Writing about the name, age, anything specific that you'd like to ask. Since in this case, you cannot make any differential from outside since it's a very vague complaint, so that's fine. But just write down driving and job and impact. Okay, so the
Mm.
introduction was perfect, confirming the name and age, mentioning confidentiality, asking about elaborating the main complaint as an open-ended question. That was perfect. Your history taking was also very focused in the beginning. So I think you were almost, you got the diagnosis, within the first few questions. But I'll just like to, tweak just a bit more changes in your history. So, you should ask about the onset. Okay, so the patient mentioned himself that it started about a year ago, but worsened over the last 1 month. You need to ask me very clear, like you did, what do you mean by vision problem? So in this case, for 1 month, he was unable to see at all. In this case, he offered the information himself that, initially it was just at evenings, at night time, and then it progressed. So sometimes the surrogate or the patient might not offer you this information himself. So you need to be you need to probe him or ask leading questions. So you can ask, is there any particular timing, or was it just one part of your vision or all of it? So one question is, asking one eye or both eyes. The second is just one part of your vision or all of it. So what we're trying to rule out here, if it's, the central vision is affected, think about macular, conditions like macular degeneration or macular edema. If it's the peripheries, like tunnel vision, think about retinitis pigmentosa. Or if it's just the sides, think about bitemporal hemianopia. Okay. All right. So rest you're, asking all those specific questions about the associated syndromes. That was perfect. Refsum and, Bardet-Biedl
Madam,
syndrome.
can you tell me again? Is it tunnel vision? And so regarding central part loss, what it means?
Yes, central part is macular edema or macular degeneration. Periphery, that means tunnel vision all around the eyes, like a narrowing vision, would be in retinitis pigmentosa. That is tunnel vision. And if it's just the sides, like both eyes, but just the temporal part, that is bitemporal hemianopia. Okay, so when you're asking about hearing specifically, it's associated with both ushers and refsum. So there's something called polydactyly. That means an extra digit in the hands. You don't have to ask the patient about extra digits. You're just going to take a look at it, during the examination. But you can ask about any procedures or surgeries, if he got the extra digit amputated in the past. So you can ask about any, surgeries in your new routine history taking. Besides, any problem with gait or balance, cerebellar and peripheral neuropathy is seen in refsums. Um, any cardiac associations, there's a KS syndrome or Kearns-Sayre syndrome, which is associated with cardiac abnormalities. So doing a cardiac review in your history is also, recommended here. So yeah, ideally you should ask about, exploring the main eye symptoms, then ruling out all these associated syndromes by asking about hearing, balance, gait, any racing or pacing of heart, breathlessness, chest pain. Okay, and then you can do your routine screening by going head to toe. You can give a disclaimer so the examiner knows that you're just doing a quick screening and not just looking for clues. So you can just say, I'm going to ask you a few questions. You can answer in a yes or no manner, and then quickly screen like you did: joint pains, skin rashes, waterworks, bowel changes. That's fine. All right. So the next thing would be the personal history part, asking about what he does for a living, how is it impacting him. So, like you mentioned, he's unemployed, so it was the right thing to do involving the social worker. You can ask first, are you financially well supported? So, if he says yes, he's supported, then you don't need to involve anyone. But if he mentions that he's been having trouble, then you can offer yes, we have a team of social workers that we can refer you to or involve. All right, next thing about smoking, alcohol, and drugs. About smoking, even if it's occasional, even if it's just one stick, always advised to stop smoking. Okay, so you need to say smoking can be injurious to health in any amount. So I would like you to consider quitting smoking. And if you need any help with that, we have a smoking cessation service. That's it. Next would be about his driving at this point. So smoking, alcohol, drugs, job impact, and then quickly driving. So do you have a license or do you drive? He'll say at this point, he's unable to and he hasn't been driving. But since he's a driver, he has a license. He just needs to inform the DVLA. Okay. All right. So the next
Okay.
thing is the examination. All right. So in this case, like the main complaint is eye. So you can either, jump directly to the examination or you can start with the general physical. Like in this case, we have a particular finding that we're expecting in the hands that is polydactyly. Look at besides the thumb. Let me just mute. Okay, so you can look beside the little finger and the thumb, okay, for any extra digit, or if there's a little scar that could denote a previous amputation. And then you can, check for the pronator drift or check the cerebellar signs in the upper limb, finger nose testing, dysdiadochokinesia, and then onto the face. Look at his face, ask him what you're about to do. So, checking visual acuity by asking to close one eye first and then the other. So in this case, he was unable to see at all. So you rightly skipped the rest of the examination. So about the fundus, if you're appearing in the UK, you'll be giving the instructions in English. So could you just tell me how would you instruct the patient that you're about to perform fundoscopy?
I tell him that I use a device to see inside your eye. This
Mm-hmm.
device will shine some light inside your eye.
Mm-hmm.
And if you don't mind, I'll be putting my hand over your shoulder and
Mm-hmm.
be close to you.
Okay, yes. And then tell him that you'll be turning off the lights temporarily. Okay?
Okay.
All right. Yeah, perfect. Okay, and then when you're done with the main things of the fundoscopy, in any visual symptom or neurological, be it headache or maybe gait problem, always offer a fundoscopy. In cases where the patient is diabetic or hypertensive, even if it's not the main complaint, offer to do a fundoscopy. Okay. So after this, you can, offer to examine the gait. The examiners might likely say, to refuse it if there's no finding, or if they have time, they can ask you to, proceed with it. Next thing would be ask the patient about concerns. You rightly mentioned, addressed his concerns, but you just need to be confident because whatever you're saying was right. It's an incurable condition. It's progressive. It's permanent. It doesn't have any cure. Vitamin A, although doesn't have a very good role in its management, but you can still mention it. About the transplant part, all right. If you weren't sure, you can obviously refer him to the eye specialist. But you can mention about it's a possibility, but it's under research. It doesn't have any proven role now. It's not being done. But if you're unsure about such things, there's always a specialist you can refer to. So you did it perfectly. About the genetic clinic, yes, you can mention it to the patient as well because you had time, and otherwise you're going to mention it in the viva. About the viva, the presentation was fine. Listen carefully to what the examiner is asking. If he says, please present your case, that means patient's name, age, uh, the presenting complaint, positive findings in the history, and positive physical findings. If they say, please present your positive physical findings, please just mention the positive physical findings. They wouldn't like it if you, start summarizing the history again because they're watching you take the history. All right, because you need to save time. You'd only have 5 minutes. I need to use it to your, benefit to, get to the investigation, get to the management to score maximum marks there. So there are no specific investigations given that, there was no associated syndromes here. But, if there was, let's suppose Usher or Refsum, there were hearing abnormalities. You could, mention audiometry. If there were any renal symptoms, you could mention ultrasound, KUB, and urea and electrolytes, urine test, as, Bardet Biedl is associated with renal symptoms and signs. Otherwise, if there were any symptoms suggestive of KS syndrome, like cardiac, you could mention a cardiac evaluation. Otherwise, in this case, just retinitis pigmentosa, you can only mention genetic screening or genetic testing. On to the management, you rightly mentioned it, education and counseling of the patient, social support is needed. Occupational therapist would provide walking aids or walking stick in this case, a white walking stick. Occupational health worker, yeah, so in this case, social workers would be fine. And, giving him websites to support groups. So the main treatment in this case, the management is, just psychosocial support of the patient and getting him back to, his improving his activities of daily living and getting him adjusted to this lifestyle. So your Viva went well too. Um, just something I would like to clarify. Candidates often mix this up. Occupational therapist and occupational health worker are separate things. Occupational therapist is the one who's going to, provide walking aids or provide any aid that could improve the activities of daily living. Occupational health worker, on the other hand, would be someone who's going to help you in your workplace. All right. Any question about this case or anything?
Thank you, doctor.
Thank you for taking the case. Anyone else has a question? About this case or any other case or any case you're having difficulty with any particular symptom?
Should we ask for any audiometry testing?
No. So during your examination, you can just offer to check your hearing yourself of the patient. But during the viva, if you think there's any association with a refsum or ushers, then mention audiometry.
Okay. Thank you.
You're welcome. So if you don't have any questions, I'll end the meeting. Outside UK, I'm aware of the UK, not outside it. No, actually it has appeared in Lahore, I think. So out of all the eye cases, there are only a handful of cases that you need to be well versed with, including a diplopia can present as thyroid eye disease, myasthenia gravis, ocular myasthenia, or third nerve palsy. There's benign intracranial hypertension presenting as I think papilledema. What else? There's diabetic and hypertensive retinopathy. These are just a couple of cases that you need to be very well practiced with. Because some cases they're like spot diagnosis. When you see the fundus, you can pick up its RP. If outside the scenario is given, the patient has night blindness, it's basically a spot diagnosis, right? So in those cases, they're wanting to see the approach if you're ruling out each condition, each associated syndrome. Okay. Yes, I'll discuss the approach to vision loss. I'm actually running out of time. I only have, 2 minutes left. But I'll, share it in the group, an algorithm, a quick flow chart that you can go through, and I'll upload a video in a day or two about vision cases. I hope that's okay, Dr. Asif. Any other questions? I'll share the recording of this case too. And all of you can follow the same pattern the candidate did today. The history taking was really good. It was almost perfect. All right, so I think I'll end the session. If you have any questions, you can ask in the group, okay? I'm available there. All right, so I'll just end the session now. Thank you for joining, everyone.